Hello, hello. Welcome, wonderful technologists. Welcome back to the podcast. No, it's been a little bit since the holidays are coming up. So, just wrapping up the recordings for 2023. Been doing a lot of self-reflection and things that I want to accomplish for 2024. So, maybe you guys have started doing that. So, it's getting colder, definitely, and probably anticipating snow at some point, right? So, hope you guys are having a good start to your week here. So, in today's episode, I wanted to talk about IV access in CT. I figured that this is a really important topic that we should discuss because it's been a topic of discussion currently where I work recently in the last week or two. So, when I talk about IV access, I'm going to talk about IV access that is acceptable and what's not acceptable when it comes to injecting contrast media and what's acceptable and not acceptable in the CT departments across the country. So now I know I have done a course with contrast media. And if you'd like to check out that course and would love to learn from it, I will have all the links in my show notes for all my courses, all my guides, and all the things that I provide education-wise. So we're going to dive into what type of IV access we use because we know as technologists that contrast media is very viscous, is very thick, and it's something that we have to power inject to get it through the patient's bloodstream. So you might be thinking, what kind of access is really acceptable when it comes to injecting contrast media? Well, typically, when we're doing any type of CT exam, whether it's a CTA, it's a cardiac study, a runoff, something that requires a arterial phase that we need to see those arteries immediately. Typically, we like 18 gauges, 18, 20 gauges, antecubital IV because we know the antecubital vein is a huge vein and it can withstand the pressure of what the power injector does give per square inch, the PSI. So typically we like 18 to 20 gauge IVs, antecubital, perfect size, right? Now, there are some instances where we just do routine studies where it's a head with contrast, an abdomen pelvis, just a regular routine chest, extremities that require contrast, something that doesn't need a quick injection, just a venous phase that gets the radiologist what they need, and it doesn't require a crucial timing. So typically we may see 22 gauges because patients have small veins, they have poor access, they're on dialysis. There could be a number of factors when it comes to that type of exam, right? So, yes, you may see a peripheral IV probably in the forearm, in the hand, in the back of the wrist, in the back of the forearm. Sometimes we do see them in the bicep. We'll see them, near, the shoulder. So here is my personal suggestion and what I have put into practice for the last 20 years that I've been a technologist. My first go-to is make sure that you flush your IVs. Depending on what type of study you're doing, make sure you hard flush that, flush it well. Make sure if it's 10, 20 cc's of saline, make sure you flush that IV to make sure that it works correctly for your exam. I can't tell you how many times I've had bad IVs and I've been told, oh, well, it's a good flushing IV. It really wasn't. Okay. It's super important because those things can become a legal issue down the line, especially if there's any injury or harm caused to the patient. So typically what we like to do is make sure that that IV is patent, it's flush, you get some venous return, you feel it going into that vein. Just make sure that you have a good working IV. That's number one. Okay. Number two, use your best judgment. I can't stress this enough in all the courses I teach, in the podcast episodes that I put out. Use your best judgment. If you feel that that IV will not hold for that contrast injection, or you just do not feel comfortable, then A, restart it, or B, get the nurse involved to restart it, whichever is the case, because we want to make sure that we're preventing patient harm. That is like the number one focus when it comes to contrast media. We don't want to induce any patient harm. And I think that this episode is so important. And I hope there are nurses listening to this episode too, because when we stress about the importance of IV access, I think there is a disconnect when it comes to the communication from nursing saying, oh, well, I flushed it and it's good, versus when we flush it and say, no, it's not good. Now, I think that as far as nursing, what I want our nursing colleagues to understand is that contrast is a medication that we're administering, and it's something that is very viscous, is very thick. It's not like your average medication where you could just hand push it at whatever speed you want. We are injecting contrast media at 4 to 5 mLs per second, which is a very fast rate, at 300 to 325 PSI, pounds per square inch. Okay, so you're injecting 300 pounds of force into this vein. So I think there is a serious disconnect with the way our nursing colleagues perceive it versus how we explain it to them. And it gave me a great idea to devise a training specific to nurses so they can see the actual way on how contrast flows through a patient through these IV accesses that they feel, oh, yes, you can use, but they are not power rated at all by MedRad/Bayer, which is the company that supplies this power injector. So I've devised a training on that, and I will have more information for it. So I'm planning on putting it out next year. So going back to IV access, use your best judgment. If you have an IV in the wrist, if you have it in the hand, and it's a simple abdomen pelvis, you as the technologist gets to make the decision if you want to use that IV or not. Now, if it's a crucial test, the patient's really sick, usually myself personally, I will test it. I will adjust my flow rate as long as it's not an arterial study. I have adjusted my flow rates for arterial studies in the past, and I can tell you it has worked wonders for me. But that is the responsibility as myself as a technologist, which I always tell all my students, anybody that I educate or train, use your best judgment, because you are your best judgment, and you know if you feel comfortable injecting contrast through the IV access you have. Now, the types of IV access that we do use besides the 18 and 20 gauge, we do use a 22 gauge IV. Now, there is also a 22 diffusix. So that is a special IV, especially if the patient can't get an 18 or a 20. It has the same power injection of a 18 or 20 gauge. It could withstand up to 325 PSI. You can inject at 6.5 cc's per second. So it's a really good way of patients, are hard to get access on. It's a really good IV to use. I know I've used it at 2 different hospitals I worked at, and it works fabulous. So everything that I'm explaining is made by Braun, the manufacturer. So if you see it in your facility, if you use it, they're good. It's good stuff. Okay. Now, there is a special type of IV. There is a 24 diffusix. I know they do an 18 diffusix, 20 diffusix, and the 24, especially when we're doing cardiacs on pediatrics. And we do use those because we do have to inject contrast. at a very, it's usually a very minimal rate, but the 24 diffusics is actually really good for pediatrics. Now, there's other forms of access that you will see on patients where you will see PICC lines, power PICC lines, the purple ones that you can power inject, which take up to 5 mLs per second. Then you also see the power central lines, which has the 3 hubs, and it does tell you how many mLs per second you can inject with that. So you might see it in the subclavian, you might see it femoral. A lot of patients sometimes have it in the neck. So those are accesses that you can inject through and does withstand the pressure because they have been power rated by MedRad. Then there's also the trialysis catheters, which actually have a purple line. They're made by the same company. They're made by Bard, and they can withstand. So it's the only purple line that can do 5 cc's per second at 300 psi that you can inject contrast when patients don't have other access. Those are some types of access. Now, you also have your power ports, which power ports, we all know that they either are circular and have CT in the middle, or they're triangular with 3 dots. And how you can verify that is by looking at the chest x-ray. Sometimes you could look at the CT scout and you'll see it, but usually we'll verify it on a chest x-ray before we even inject any contrast on the patient. And then there is a line that goes in that the nurses access, and then we can go ahead and power inject 5 cc's per second at 300 psi. Now, with all those that I've mentioned, I'm going to give you the ones that you should not use. And I don't care if a nurse or a doctor tells you you can power inject through it. If it's not been tested or verified or approved by Bayer, which supply MedRad. So the company is Bayer and it's MedRad, which is our power injectors. You should not use it. And I'm going to explain to you why. There are several types of accesses that you should not use because they are not power rated. And I know a coworker and I had reached out to one of the drug reps that supplies us these at our hospital and has specifically told us that you cannot use it and it's not power rated. So the types of accesses that you should not be using for a power injection are Cordis, Hickman's, a Broviac, which is a pediatric line, any type of PICC line that is not power rated, any central line that is not power rated. Those are things that you should not be using. Okay. When it comes to a Cordis or a Hickman, those are sheaths. Those are what are used to get venous access into the patient because they have to slam a bunch of fluids, they have to slam a bunch of drugs, and they have to get things into the patient to keep them alive, basically. Okay. So you see a lot of cardiac patients that have Cordises, they have Hickmans, they have a Swans. Those are things that you cannot power inject through. There is no literature, and these types of accesses have not been power rated through MedRad and have not been verified to use them for IV contrast. Now, we recently had a situation at my hospital, 2 incidences where patients come down with this kind of access. We ask them beforehand what kind of IV access they have. They tell us, oh, they have a power central line. So automatically we're thinking, okay, they do have an ENROLL power central line, right? Well, that wasn't the case. It was a Cordis, and we specifically explained how we cannot inject through a Cordis, where the nurse for the patient took it upon herself to call every doctor that is associated with this patient to get the approval. Now, I'm going to be 100% honest with you, and I take my job very seriously. Injecting through a line that is not power rated, that has not been verified or cleared through MedRad is dangerous, and you can compromise the patient's airway. You can compromise their access. You can compromise a lot of things that can go wrong and cause harm to the patient. So my strong recommendation is please do not use it if it's not labeled, if it's not been power rated, and it's not an access that I've explained. Okay. So it's super important. And I know colleagues like to argue, doctors like to argue, but we have to stand firm because it can compromise the patient. And guess what? That can end up as a legal issue, and the nurse and the doctor are not going to cover you. So it's something that you have to take in mind and make sure that you're mindful when it comes to that. So it's about protecting yourself and protecting the patient. Those are accesses that we do not use. And it is crucial that you stand your ground and you let them know, sorry, but this is not something that's power rated. It's not labeled. And you can even reach out, because most of these drug reps, these medical sales reps, you can get in contact with them and ask them and say, hey, is this rated for a CT power injection? I could tell you when it comes to Cordis, Hickman, Swans, they're going to tell you no. How do I know this? Because we've contacted them ourselves. And that's how we know. So I hope that gives you a little bit of insight as far as contrast media, because contrast media is a great tool to diagnose patients when they have different types of diseases and different types of conditions. But we also have to be mindful in making sure that we keep them safe when it comes to safely injecting contrast media, and make sure that we have the appropriate access and that it is power rated to sustain that injection. So I hope this was really helpful in making sure that you understand what types of IV access are okay and what is not okay when it comes to CT. Now, I do have an entire contrast course that I have put together that I will link in the show notes. It goes over all that. It even comes with a PDF download guide to kind of keep you in the loop as far as what types of accesses are good and what are not. So if you ever need any educational help, tips, courses, everything's in the show notes. Head on over to Instagram, give me a follow. Make sure you subscribe to this podcast, like, share, because I'm always putting out good stuff for you guys. And in 2024, we're just going to ramp it up and we're going to just do some more stuff. Okay. So head on over to Instagram, give me a follow at the CT Educator. Of course, if you have an interesting CT story, I would love to hear it. If you want to be a guest on the podcast, would love to have you. Would love to have some guests. We're going to bring on some guests for 2024. I will link a application, a form that you can fill out to be a guest. Email if you have any questions, any concerns, or anything that you would like my help on. Please shoot me a DM on Instagram. Send me an email. If you want to be a guest, fill out the form so we can get you on the podcast. So hope you guys have a great week, and we'll talk to you next week.